Hello, hello, hello. Assalamu alaikum. Ji ayanum, pakhair agale, ni hao, chune shumme, washmale, ohio gonzaimes, guten morgen, hola, bonjour, privyet, kaifa hal, hale shuma chatore, ahlan wasal, marhaba, buna, mucho, gracias, suavigap, and a very amazing good morning to everybody who's tuned into PTV World and watching World this morning alongside Shazad Khan. Ladies and gentlemen, wherever you are, in different parts of the world, we definitely hope and pray that everybody out there is doing just perfectly fine. Ladies and gentlemen, this is a very testing time for all of us, for people all over the globe, for the total population of the globe, and I think that it's only patience which is actually going to take us through. But other than that, I literally hope and pray every day for the betterment of all the people on the face of this planet. And not just that, I hope that everybody is taking all of the precaution measures because of COVID-19. Now, ladies and gentlemen, as we all know that everybody has been in quarantine or self-isolation, or they are staying within their homes, and I think that Pakistan is doing very well. And as a matter of fact, there are other organizations who are actually commenting on how well the Pakistani government has actually taken notice and then at the same time have acted upon all of it to make sure that that the disease does not spread on that scale where we can see in Italy or China or elsewhere or even in the United States for that matter. But other than that, I think, ladies and gentlemen, in this time, we definitely need to join hands. We need to be together. And we need to make sure that if one of our brother or sister is going through problems, that we are out there and we are helping somebody else as well. Not just that, since obviously our, phone time has increased quite a lot, and it's because of the fact that we all are sitting at home. So I was just going through, different profiles, and I was just looking at what people are doing. So it brought immense happiness to me that there are people who are actually making sure that nobody sleeps hungry within our own country as well. And not just over here, I think wherever Pakistanis are, they are actually trying to give and donate as much as they can. And I've said it earlier as well that Pakistan actually ranks amongst one of those countries which are most philanthropic as well, and maybe the earthquake in 2005, maybe the floods in 2010. And alhamdulillah, I'm very happy, and I take pride in it that I've always been a part of it and such drives as well. And not just that, ladies and gentlemen, for everybody who's actually going to their studio, for every army man, for every police officer, for every Air Force personnel, I think that everybody who's going to their work every day, they're the frontline warriors. They have immense respect in my heart and in the hearts of all the Pakistanis out there. But there's this one simple thing which I want to let people know, and that is that, ladies and gentlemen, the disease is not coming to you. You are going to get it yourself. So please make sure that you stay at homes. And if there's any kind of problem, all you need is to call someone, So whenever there are testing times, ladies and gentlemen, we call our friends, we call our parents, we probably call our wife, and we ask them, or we probably just want to have a word with them that, okay, this is what I'm going through, can you help me? So this is the kind of solution which we need in these times as well, because world over, globally, ladies and gentlemen, and since I was traveling recently as well, so what I've seen is that, they have shut down, well, not really shut down, but they have actually instructed all the doctors to make sure that they actually go online on Skype or on WhatsApp and give consultations to all of those patients who require them. And I think that this is something which we have been working on in the past years as well. But now, all of a sudden, we see that, that the importance of such a segment has just emerged. And everybody is actually trying to make sure that they have somebody's number who is actually a doctor, and they can call him or her so that they can ask about the problems they have. Even though there are certain helplines which government has provided us all over Pakistan where we can call 24/7 and ask about the symptoms, but those are dedicated to coronavirus only. But not just that, ladies and gentlemen, today we're very lucky that we've actually been joined by a team of doctors over here in the studios with us. They traveled all the way from Lahore. So imagine that they recognize the importance of people knowing what they are actually doing, because they are actually giving us telehealth solutions, ladies and gentlemen. It's an application, you download it, and then, there are the names of doctors as well. So whoever you want to consult, you pay, and there's a barcode, so, that's how your money goes away. So this is a little information which I have about it, but we have the team behind all of this as well. There are people who actually call them from remote areas, from Balochistan or from elsewhere as well. So imagine how important it is for people to know in the first place that there's this application, there's this telehealth application which is available. You can call them, you can talk to them, you can talk to them face to face, you can FaceTime them or Skype them, or whatever the procedure may be. But imagine knowing that while being at home, you will be able to talk to one of the best doctor which is available in that particular city, or maybe that they reside somewhere else, but then you can still get that feeling that you're actually talking to a doctor and you will feel great. And I think that it's a great initiative. There are a lot of payment methods involved in it as well. We're going to ask them. But what is telehealth in the first place? I think that this is something which we really need to learn about. And not just that, I think, ladies and gentlemen, that the digital healthcare landscape has widened already. And I think that a lot of people are working towards that as well. We have had a lot of people who have such platforms online who are helping people remotely as well. So ladies and gentlemen, to talk about this, we're very lucky that we've actually been joined by the head of telehealth as well. He's none other than Dr. Asfar Malik. Hello, assalamu alaikum, good morning. How are you?
Walaikum Assalam. Thank you very much, sir. I'm fine.
So thank you very much for joining us. And I think that, you obviously have a very brave heart, and it's because of the fact that all of what is going in the country, you still managed to come from Lahore to Islamabad just for the interview. Thank you very much. And yeah, respect levels just going up. Thank you very much for joining us.
Thank you for inviting.
Thank you very much. And alongside Dr. Asfar, ladies and gentlemen, we've actually been joined by a PG trainee, pediatrics as well. She's working with Dr. Asfar as well. She's working for telehealth as well. She's none other than Dr. Saika Saeed. Hello, assalamu alaikum, good morning. How are you?
Walaikum salam, I'm fine. Good morning.
Thank you very much for joining us. It's wonderful to have you. So ladies and gentlemen, let's get the conversation started for everybody who's out there. Ladies and gentlemen, as I've mentioned, that we really need to make sure that people in the remote areas get to know about it. So for everyone in 45 different countries, whoever is watching us, please make sure that you let everybody know that there's this application and you can call the doctor from anywhere in the world. So Dr. Asfar, I'm going to get started with you. So this is a company which back in 2017 and 18 thought about telehealth services as well. How did it all happen? What's happening, and what is telehealth application itself?
Well, sir, Medicount Private Limited was incorporated in July 2018.
All right.
And Health Pass is the retail product name of our company.
Okay.
And Health Pass is backed by Allianz X, which is a German financial group.
Okay.
Now, we at Health Pass, we really believe to improve the health of people of Pakistan.
Okay.
Now, this is our vision, the vision with which we started with.
Yep.
So, initially we started as a digital payment solutions company at healthcare service providers.
Okay.
And during this endeavor, we were successful in empaneling more than 500 plus top quality healthcare providers throughout Pakistan,
right,
in all the big cities.
So are we only talking about healthcare providers, or are we even including hospitals, small clinics, everyone in it?
It's a good question, sir. When we say healthcare provider,
yep,
it means clinics,
yep,
hospitals, labs, pharmacies, medical imaging centers such as CT scan, MRI.
Yeah,
so it's a complete ecosystem of when we say.
So initially, just to correct myself, so initially when you started, it was an online payment solution. So wherever you're going, may it be to a hospital or may it be to a lab, so what we have to do is scan the barcode and that's it, your payment's done.
QR code, sir.
QR code, yes.
It started as a digital payment solutions company for healthcare providers specific only.
Yeah, well, that's great. So now moving on, talking about this telehealth application, when was this made? When the telehealth application came into being, and what is the sole purpose of this application?
Okay, having successfully started the QR model, in the first quarter of 2019, our board and our CEO, we decided to set up a telehealth app.
Okay.
So by July 2019, our app was up and functional, both at Android Play Store and Apple iOS.
Oh, well, that's great. So anybody can download it. And is it for free, or do we have to pay some amount?
Sir, initially the first call is free, and for the second call there is a very nominal fee of rupees 150, where you can access 24/7 MBBS and FCPS doctors via our app.
Wow. So
any time of the day.
So what we are trying to say by saying that MBBS doctor and FCPS doctors is that we have physicians on the application, not surgeons.
Even we have two umbrellas. One is the MBBS doctors who are there available 24/7.
All right.
And we have also a network of consultants which with 25 specialties and more than 60 consultants, including oncologists, physicians, dermatologist, endocrinologist, you name it, and we have it on our app.
Well, that's great. So ladies and gentlemen, here it is. So what you need to do is that you need to download this telehealth app, and you obviously need to make sure in the first place that you know which doctor to call, whether, I mean, unfortunately, I don't think that anybody has to call an oncologist, but just a physician probably, if there's a problem in your chest, first of all, I think it is very important for people to identify which doctor to call. That is very important. So having a wide range of doctors from each and every field or from different walks, obviously within the medicine, I think that that's very fruitful for everybody to know that there are people out there who will be talking to them and giving them solutions. But very quickly, sir, this 150 rupees charge which you're talking about, this charge actually includes the fee of the doctor as well, or is it just the call charge?
Sir, it includes everything. I mean, you just have to pay 150 rupees and you can consult a doctor. For consultants, there is a separate fee structure.
Okay.
But this 150 rupees is for the general MBBS practitioner doctors, and they are on our payroll, and you can consult them. They actually sit at our campus in Islamabad.
Wow.
They sit in-house so that the discipline and the quality could be maintained. So they are available 24/7, morning, evening, night shift.
Wow. And I think that it's fabulous as well. So ladies and gentlemen, it's a 24/7 thing, even in the middle of the night, you wake up and you think that you're not feeling fine. What you can do is that you can probably go into this application and figure out yourself the kind of problem you're going through and just talk to the doctor. So, I mean, don't you think that it is a little difficult to get the doctors to be up at night and then talking to their patients or probably somebody else, even though that it's their responsibility, but, having or making sure that the doctor will be available 24/7, don't you think it's a little difficult for the doctors to manage?
It's a very valid question from your side. Now, that's the reason that we are running our own in-house campus, where doctors actually have to join the duty, come from their home, sit at the workplace, sit at the desk, and so that the discipline and the quality could be maintained.
Wow.
So we are probably the only telehealth company which has introduced this concept that doctors should not sit at their homes, but they should actually come to a campus and sit at their workplace, just for the reason that you asked, that they are attentive, they know they are going on a job, they are on our payroll. They don't take a call for granted. Because, I mean, they are actual employees of our company, and so it's a proper corporate responsibility for them to be attentive and to be...
Well, that's great. Thank you very much for telling me, because I, to myself, thought that, the doctor might be sleeping and he just picks up the call and he's like, okay, what's happening? Is everything all right? But no, ladies and gentlemen, the doctors are within their own clinics and you can call them, and they've made sure that they're on their payroll. So there are no excuses, and it's a professional thing. So far, 50,000 downloads as well. But let me move on to Dr. Saika over here. So Dr. Saika, I know that it's your first interview, and I hope that you're very relaxed over here and that you do not have any problem.
I'm perfectly fine.
So let me ask you, what kind of different queries do you get on telehealthcare as well?
First of all, I would like to tell you that on telehealth consultations, we don't deal any kind of emergencies. So if a patient calls for high blood pressure, high sugar levels, or any other emergency, in such situations, we refer our patients to established hospitals and clinics so that they can, that they can get the immediately emergency treatment. Apart from that, most frequent telehealth consultations are throat infections, uncomplicated chest infections, diarrhea, food poisoning, gynecological issues. And we also provide consultations on some taboo topics where patients do not feel comfortable to consult doctor face to face, and they feel more comfortable to consult doctor from their home and from their own comfort zone.
Well, that's great, but I think that, since we're talking about Pakistan, so there are 71 different languages in Pakistan. And normally, when obviously from Islamabad or Lahore or Karachi, wherever you go, you see that people speak Urdu very fluently. But speaking about the remote areas where you, even before the show, was telling me that, there were people calling you from Balochistan where there were no hospitals approximately in 100 kilometers area. So how do you communicate with them? Do you have interpreters, or do you have doctors who can speak in the native languages? How do you go about it?
Actually, we are having doctors who can speak every language, alhamdulillah. They speak Urdu, English, Pashto, even Farsi. So it's easy to get them.
So it's easy. So, you can pretty much communicate with everybody out there as well. So, Khawatino Azad, I think I need to say it in Urdu as well. TeleHealth जो application है, ये एक ऐसी application आप इसके मोबाइल में डाउनलोड करें. ये किसी इमरजेंसी में नहीं डील करेंगे, लेकिन आपके पास डॉक्टर्स के बहुत सारे राब्ते होंगे इस एप्लीकेशन के अंदर. आप उनसे बात कर सकते हैं. 150 रुपये कटेंगे आपके. आप पूरे मुल्क में, पूरी दुनिया में आप कहीं पे भी हैं, आपको डॉक्टर की सर्विसेज अवेलेबल होंगी जो छोटे छोटे मसले मसाइल रात में किसी भी परेशानी का बाइस बन सकते हैं, उनका हल आपको दे दिया जाएगा इंशाल्लाह. But now, focusing on this aspect of the telehealth care as well, Dr. Saab, I'll move on to you because I think that it's a little difficult. So what I want you to tell us is, don't you think that over the phone, the diagnosis can actually go wrong? Because over here, what I've seen in Pakistan, that people half of the time, they might have a shoulder pain, but they're going to tell the doctor that they have got pain in their palm or probably the hand. So people over here are not so educated that they can let the doctor know what they're going through or what kind of sufferings they have. I mean, for example, if the doctors are going to ask them for symptoms, they'll be like, "Suiyan chubh rahi hain sir ungli mein." So I know that the doctors are very experienced, but do you think that there are fair chances of the diagnosis going wrong?
Yes, sir. Even Dr. Saika knows this because she was one of our initial doctors. Even before the app was not functional,
Yep.
I had personally compiled a list of telehealth notes for the doctors.
Yep.
And the one chapter was which telehealth consultations to avoid and give first aid and refer immediately.
Okay.
Like it had about 15 such scenarios
Alright.
and symptoms, like if somebody is presenting with a chest pain and sweating,
Yep.
and even if it is a diffuse chest pain, you can't localize it to heart, but there is a suspicion. So it was, the instructions were to give the first aid and refer immediately to the nearest healthcare provider.
Alright.
Similarly, there is a trauma case, there is swelling, suspected fracture, low sugar level, high sugar level, hypertension, anything. I mean, there's a complete list of guidelines. This is a very valid question. The telehealth cannot be one step forward and two steps backward,
Yes,
because
exactly.
any mishandled case could bring a blot or blue spot to this whole ecosystem of telehealth.
Exactly.
So we are a professional company, and as I told you, complete guideline notes are there for the doctors. Our doctors are very professional. As I told you, we have in-house doctors, and there is a scrutiny method to hire them.
Okay.
There's a quality compliance method.
All right.
We have good market standing, and we offer very good salary package also. So that's a very important point.
Exactly.
That you are able to attract and hire quality doctors throughout Pakistan.
And that is very important.
That is a very important reason, that how much you attract them.
Exactly.
And most of the doctors are postgraduate training.
Wow, that's great.
One is Dr. Saika is postgraduate training in pediatrics. Dr. Adarzan is in pulmonologist. So mostly our doctors are PG trainees. They are not just MBBS. So there is a diversification of their experience and their expertise also.
So you've always made sure to pick up on quality rather than quantity as well.
That's very important. That's the reason we are operating in-house also.
All right, and that's great. So let me move on to Dr. Saika over here very quickly. So Dr. Saika, since you are one of those people who were there since the beginning and since the conception of this idea of telehealth over here in Pakistan as well. So, over here in Pakistan, we all know that, the majority of the population has got stunted growth. We eat oily foods, we have cholesterol levels are always high, diabetes, hypertension, and all of these things. What are the most common problems people come across, when they call a doctor? What are the most common problems which telehealth has incurred so far?
Most frequent consultations, I already told you that people come to us with gastric problems, stomach problems. As you mentioned before, actually there is sedentary lifestyle.
Yes.
They do not like exercise or gym or other activities, and they like sedentary lifestyles. Apart from them, we usually encounter urinary tract infections, hygiene problems, and some gynecological issues. So these are the most common.
One important point I would like to take, the taboo consultations. Now this is a very important aspect of telehealth.
Exactly.
People are afraid to consult doctors face to face in person at clinics. So they are caught by the quacks.
Yeah.
And even in majority of cases, they end up having their kidney failures due to all that wrong medication and non-allopathic medicine.
Exactly.
So the telehealth main role is to generate awareness also among the masses.
Okay.
So if anybody, any youngster, any teenage girl or boy or anybody who is having some issues that he wants to discuss with a doctor and wants to take guidance, like in Pakistan, we don't have any formal schooling system where children can be guided regarding the medical education or about whilst they are growing up.
Exactly.
What they need to know, nobody knows. It's not a part of our school syllabus.
Exactly.
Right or wrong? This is how it.
That's true.
And they end up at the hands of quacks.
Exactly.
So the role of telehealth to address the taboo topics. A doctor is there, he is there to guide you, for youngsters especially, and even for mature people, they have their own misconceptions about health, about medical misconceptions.
Exactly.
So this is also a very important aspect, and we also cater such consultations also.
Exactly, and that's very important. Thank you very much for raising this point, ladies and gentlemen. I think Dr. Saab was actually trying to say that, when we are growing up, obviously over here in Pakistan, there are a lot of things which are stigmatized or tabooed. For example, let me give you an example of sex education. Now over here, parents are obviously not very willing to let their kids know that this is something which will be a part of your life in days to come when you'll be married or otherwise as well. But I think that parents shy away, and when parents shy away, and this is one of your class fellow telling you in probably 7th or 8th grade, I think that that's too much information, and that too coming from a very wrong source. So I think that that's a great initiative you've spoken about. But very quickly, so in these days, very testing times, and the world is in a distress as well. It's coronavirus all over. So how do you think that telehealth is actually helping people to make sure that they are fine, or probably what they really need to do, what kind of precautions they need to take? Anybody who wants to answer.
Yes, so this is a time of adversity and challenge, not only for Pakistan, but for the whole world.
Yes.
And we at Health Pass and at TeleDoc app, we stood up to this challenge. And the very first thing we did, that we made first call absolutely free from 12 midnight to 12 midday.
Okay.
Just download our app and you don't have to pay anything for your first call.
Right.
And from 12 midday, the first call of 150 rupees has been reduced to just to rupees 1. It's just a token amount.
During the day?
Yes, sir. Just
for all of those people asking about coronavirus, or anybody?
Any consultation.
In these days.
This is our, expertise, that we are not limiting our free consultations just to coronavirus.
Okay.
Any consultation, because we are privy to fact that OPDs have been closed.
All right.
And the hospitals across Pakistan are not functioning at per their optimal capacity.
Yep.
So we stood up to our corporate social responsibility, and with our board of directors and our CEO, we took this decision that this is the time to help Pakistan, and our fee is just ₹1. And I am very glad that during these times we are catering calls from far off remote areas of Pakistan. Even Kharan district of Balochistan, Dr. Saika would like to tell the use cases, but we feel very proud. And this is the time when people actually need to have a audio video contact with the person, so that their fears and apprehensions, like if somebody is even suffering from a flu, when you have a face-to-face interaction with a doctor, it's a different story. An audio call is a different story.
All right.
It's a whole different ball game when you actually see the doctor. So we have instructions that doctor's camera should be on all the time. They should be well dressed, they should be happy, they should be smiling. The role of doctor is not to create some panic among the patient. So our doctors are mostly smiling when they talk to a patient, and they reassure them about their symptoms.
I'm sorry, I'm going to stop you over here. I know that this is something very important as well, and this needs to be done. This civilized culture needs to be inculcated, and that's very important. But do you think that at times otherwise can happen as well, that the doctor is not in the mood, he's not smiling at all, and somebody called you and complained that, Dr. Saab is not even in the mood to talk to me, what should we do? So is there a complaint center or where we can call and tell that, we're not satisfied by the kind of service which was provided to us, where we have even paid 150 rupees, because it's Pakistan, anybody can do pretty much anything. So what do you do with that doctor where people are not happy with his services or her services?
So we have a complaint email also, and a complaint helpline also.
Okay.
And that helpline is not only limited to complaint, it is also a telecon consultation also. If somebody is in the village and he doesn't have access to internet or smartphone, they can call our helpline. On our helpline, there are two options: call to an agent or talk to a doctor. So if he has some complaint about any doctor, or he had a sour experience with a doctor, he can call to an agent and register complaint, and that complaint comes directly to me every day. And the second option is...
So then if you receive a complaint, we'll move on to the second option as well. When you receive a complaint, what do you do then? What's the next lie, Amal? What's the next step?
Fortunately, it's been more than 9 months and I haven't received a single such complaint.
Wow.
The reason behind is the quality manpower. In every organization, if you hire the right people, if you treat them well, if you keep them motivated, I think they will always smile.
Exactly.
As I think there is a saying, if you keep your employees happy, they will keep your customers happy.
Well, that's great. So ladies and gentlemen, that's how it's going down the line as well. But then very quickly, I think it's very important that we talk about this aspect where teledoc, ladies and gentlemen, is very helpful for everybody else, and it's because of the fact that people from remote areas where there's no hospital in a 100-kilometer vicinity, what they can do is all they have to do is download teledoc, make sure that that they call and that the doctor will be there. But you know, to ask about such experiences, we'll have to move on to Dr. Saika, where so Dr. Saika, you were telling us that you were getting calls from Balochistan,
Yes.
somewhere from Gilgit-Baltistan as well, from where there are no hospitals elsewhere. There's only one thing which I wanted to ask you. So, in such remote places where there are no hospitals, there are no internet or no nothing, how did people get to know about teledoc and how did they download it? What's the procedure, or probably is it the people at the pharmacy who've downloaded the application and they're helping people in their village? How does it go around?
It's a technical question, so
Sure, go
I
ahead.
would like to answer. We have also teledoc reselling agents. Like in
Okay.
Balochistan, we have certain pharmacies that are linked to us. So the pharmacist is using his mobile phone,
Okay.
and his number is whitelisted. He is going to the remote areas. He is going to tents even where the
Yep.
Bedouins are living and the traditional Balochi people live. So
Yep.
that's how, I mean, we have established this teledoc reselling concept, where in a vicinity, if a local person who is a healthcare provider, maybe a pharmacist or a nurse, and who has a little bit know how the things work, that could be used as a hub and spoke model. So
Alright.
that he could be our agent there. He can arrange the telehealth consultations to the masses who don't have access to smartphone or internet.
Okay.
So this is the exact use case where a pharmacist in Balochistan actually expedited a call.
Wow.
Dr. Saika can explain that.
Sure, go ahead.
I have a very good experience in remote areas of Pakistan.
Okay.
I would like to share an
Sure,
example
sure.
with you. A few days back, I received a call from Kharan, that is a district in Balochistan,
Yep.
and it's a very remote area. People do not get medical facilities very easily. It's
Yep.
very difficult for them to access the doctor. So what I noticed on video call, that a female patient called me, and she was sitting in a tent.
Alright.
In a very pretty condition, wearing some traditional dress and having some traditional
get it, yeah.
ornaments. So actually I diagnosed her, and she was having stomach ulcers.
Okay.
And she was having excessive weight loss since 2 years.
Okay.
So I prescribed medications, and after 2 weeks, surprisingly, she called me again
Yeah.
for special thanks.
Wow.
And at that time, I felt very happy. So I think telehealth will become more popular in remote areas in future also.
Exactly. And I think that, ladies and gentlemen, we need to adapt with the changing trends as well. But the conversation has been very lovely so far. And I think that at this point of time, ladies and gentlemen, we have to go for a short break because we have another segment. But Dr. Saiba, if there's anything which you think I've missed out on, you can please let the people know where to download the application from and what is the procedure, just very quickly.
Just a quick wrap up that our app teledoc is available both on Health Pass and on Android Play Store and iOS Apple, and it could be downloaded there. Just a brief, I would like to say about the future of telehealth,
Yes, sure,
because this
go
is what is very important for Pakistan.
Yeah.
So we at Health Pass, we envision a very promising future for telehealth, and our vision is that this telehealth is not limited only to a teledoc consultation.
Okay.
We want to establish a complete digital health ecosystem. That also includes not only teledoc but online pharmacy, online lab, and online home medical services. That is, the patient's journey doesn't end at the end of a teledoc consultation. If some medicines have been prescribed, he is able to order those medications online, like
And
just
they'll be delivered at his place.
at home.
And then the teams will be going there to get their blood samples.
Sample draw at home via
Actually,
phlebotomist.
patient gets treatment at their
Doorstep.
home.
Yeah.
Yes.
And that's great.
And not only that, if some IV medication is required, a nursing care is required, or attendant care is required, even that could be ordered online.
All right.
So it's a complete, like a food panda model for healthcare.
Wow, well, that's great.
And
So
all
basically,
these,
it
apps-
saves everything: energy, time.
Exactly. And
money.
ladies and gentlemen, it is a window which is full of solutions, so you really do not have to go anywhere because this is what people call it. This is known as the one window solution, ladies and gentlemen. Thank you very much, Dr. Saab. Thank you very
Thank
much,
you,
Dr. Saiba, for
Thank
taking our time and traveling from all over Lahore to Islamabad for this interview. Not Dr. Saika, but Dr. Saab as well. Ladies and gentlemen, for everybody who's out there, we actually have to go for a short break, and when you guys will come back, because we have received enormous amount of emails on our pages as well, that there were questions which were being asked by pregnant women in these days of pandemic, ladies and gentlemen, what they need to do, how do mothers need to look after their newly borns, or people who are actually, or women who are actually pregnant at this point of time. They were very worried. that whether their child, which is about to be born, prone to coronavirus or not. So we actually have a sonologist to talk about all of this as well. Please don't go anywhere. We'll be right back. And thank you very much, Dr. Saiba. Thank you very much, Dr. Saab. Please make sure that you actually download TeleDoc, ladies and gentlemen. It's actually going to help you as well. And in times of need, you really need somebody to talk to. So, and I think that this is fabulous. But very quickly, one last thing. So after talking or being in conversation with the doctor, is there any option on the application that we can give a review about the doctor?
Currently, it is in our sprint, and it will be functional within a month.
All right. Well, that's
5-star rating, 1-star rating, like the
yeah. Like booking.com.
Yes, sir.
So thank you very much for being with us, ladies and gentlemen. We're going for a short break. Don't go anywhere because we are here for you.
How many people usually recover from the disease? About 97% patients recover from the disease. Precaution, not panic. How does COVID-19 spread? The disease can spread from person to person through small droplets from the nose or mouth of the infected person, which are spread when he coughs or sneezes. You can also catch it by touching the objects and surfaces around an infected person and then touching your eyes, nose or mouth. You can also catch COVID-19 if you breathe in droplets when a COVID-19 infected coughs out or exhales droplets.
All right, ladies and gentlemen, welcome back for everybody who just got tuned into PTV while you watching World this morning alongside Shahzad Khan. Ladies and gentlemen, before going towards the break, we were actually in conversation with a team of doctors who were actually letting us know about this TeleDoc application, which you can download on your cell phone and actually be in conversation be online with your doctor and talk to them about whatever problems you have. Obviously, they do not deal with emergency patients, but they do deal with people, for example, stomach aches, headaches, flu, and these normal problems which are not very important to attend to as soon as possible. But other than that, ladies and gentlemen, as I've mentioned, that we've got a lot of mails, a lot of people are writing to us that my wife is about to deliver, and are we more prone towards, or is our baby more prone towards having the coronavirus? And then there have been a lot of questions about it, or for mothers who just became mothers, they are very worried about their newlyborns as well. So we'll be talking about that. But very quickly, ladies and gentlemen, we have been hearing that what we need to do in this time of pandemic is that we need to wash our hands with a soap, and we need to wash them for continuously 20 seconds. And I think there's a big question mark. Why 20 seconds? Why not 10 seconds? Or why not 15 seconds? And we do not have a habit of dhote jao, or keep on rubbing our hands. But why is it important? This is something which I want to ask from my very amazing guest over here, ladies and gentlemen. She's none other than a consultant sonologist as well. She's none other than Dr. Noreen Tariq. Hello, assalamu alaikum, ma'am. Good morning. How are you?
Assalamu alaikum. Good morning. How are you?
Absolutely perfect. Thank you very much for joining us. So here's the question. That everybody needs to wash their hands with the soap and for continuously 20 seconds. Why 20 seconds?
Bismillah ar-Rahman ar-Rahim. Before I start my talk today on coronavirus, and especially the washing hand, I would like to quote here a medical proverb. Wash your hands before you go out to protect others, and then wash them again to protect yourselves. And when we say protect others and protect yourselves, here protection reflects saving lives. Because washing hands these days are basically essential for saving lives.
Exactly.
And the whole world has now realized, I mean, not thanks to coronavirus, but thanks to coronavirus, the whole world has realized the significance of self-hygiene and of washing hands. And alhamdulillah, most of us here observe the highest form of hygiene anyways, 5 times a day, at least 5 times a day. But the world has now realized how important it is to keep yourselves clean and wash hands again and again. And before I come back to your question, why wash with soap and why at least 20 seconds? Infection, I would like to throw some light on coronavirus infection itself. Infections, as we all know, can be of 2 types. They can be bacterial and then they can be viral. Bacterial infections, as most of the laypersons even know, bacterial infections can be, they are bacterial in origin, and bacteria are microscopic organisms. They cannot be seen with naked eye. And the basic fact is that they can survive outside a host body. And luckily, we do have treatment for them, and that is, as we all know, antibiotics have been invented to treat bacterial infections. But very, very unfortunately, viruses are a different set. They are not essentially living. They are microbes. They are nanoparticles. They are structures with a single strand of RNA. They cannot survive outside a host. And unfortunately, these days, currently, due to the coronavirus situation, is human bodies are the latest host of these viruses. And to this date, we do not have an absolute or definitive treatment for viral infections, although vaccines have been invented in previous past. And so, as we must have heard, polio was once a very big threat to the human race. And then a vaccine was invented, and it's almost eradicated from the world now. Now, coming back to coronavirus.
Why 20 seconds?
Why 20 seconds? Yeah. So when we say why 20 seconds, basically because this coronavirus has a structure which the outer layer of this virus is of protein and fat. So you can imagine it's a small grease ball. And when your hands get infected with droplets of oil, the oil doesn't wash away with water only. So soap, basically, you can, coronavirus is a very sticky virus. So when you wash your hands with soap, soap basically helps to dissolve the virus, and then when you rinse it with water, it washes away. And not only the question is of soap and washing it or rinsing it for 20 seconds, the thing is the technique, how you wash them. So you lather your hands with soap very well, both surfaces, and then go in between your fingers and try to cover your wrist as well. And this is how, when you rinse it for 20 seconds, you basically make sure that your hands are now clean of the virus.
Well, that's great. Thank you very much for letting us know as well. And ladies and gentlemen, I think that these days the only OCD people have got is this one, to wash hands and keep on washing their hands as well, which is great. But Dr. Saiba, I think that what people would love to know over here is that, since you have been affiliated with women's imaging as well, so how do you think that, that your speciality can be of utility in this time of pandemic?
Myself being basically a consultant sonologist, and I deal especially with women's health imaging. Well, let's realize the basic fact that women are they are the frontline warriors.
Exactly.
Be it a small setup inside a home, inside a small kitchen where a mother is cooking food for her kids, or be it in a larger hospital setup where a healthcare worker is fighting to prevent or to save its patient's life.
Exactly.
So women are the frontline warriors. They bring the responsibility of the society on their shoulders.
Yeah.
So when they are at home, they are responsible for their families. They have to be they have to play the role of a wife, a mother, a daughter-in-law. So when I say women's health imaging is correlated with this, that brings me to the point that women have to assure that they are themselves in the best state of health, especially because they have to play their role in different sets of their life.
Yeah.
Of course. So we have to make sure that they are in the best form of their own health. And when we talk, I mean, your next question, I'm assuming, must be about pregnant women. Yeah, because this is a question that I've been hearing so much constantly throughout my practice. Dr. Saab, I'm pregnant. What happens to me? What happens to my baby?
Exactly.
Relax. Well, first thing first, congratulations, you're pregnant. Secondly, rest assured that pregnancy in no way makes you more vulnerable to this infection than the general population. Okay, so that is the basic fact that we all need to realize, that pregnant women are not vulnerable to coronavirus infection more than a general population.
How? I mean, this is a very interesting thing you've said. So to my understanding, what you said right now is that there are lesser chances of pregnant women getting coronavirus than the general masses?
Well, not lesser, but not greater by that.
Okay.
By any sense, not even greater. So, I mean, pregnancy is a condition.
Yeah.
It is not a disease. Pregnancy is a status of a woman during the reproductive years of her life.
Exactly.
So when again, I would repeat, coronavirus infects, or coronavirus finds a host who's already vulnerable, so who's already at higher risk. So the age group above 60, and then there are people with pre-existing conditions such as diabetes, or older age group, diabetes, carcinomas, cancers, anything which makes you more vulnerable, any condition. So pregnancy is just a state of during, it is not a disease.
So then let me ask you, do you think that the immunity levels of a pregnant woman are much more lesser than any other woman? Okay,
no, they're not.
Thank you very much.
A pregnant woman is just like any other general population of the woman, except the reason that she is actually caring for two lives, not for one.
Okay, so well, I think that's a great news as well. So what about women, because they're very worried about their unborn babies, and then there are women who are worried about newly born babies as well, mothers. So how do you think that they need to differentiate, and how do you think that they can protect their babies from getting coronavirus as well? Because for the delivery part, anybody will have to go to the hospital, and I think that these days hospitals are not that safe, even if they take all the precaution measures. So what are the best solutions for the babies? Because everybody's going to come, everybody want to touch the newly born baby as well. So I think that the mothers need to be a little ruthless. Come on, you're not supposed to touch my babies.
Not ruthless, but let's just get to the basic fact that yes, we are facing a pandemic. Coronavirus is a fact; it is there. We cannot deny it. But on the same, in the same scenario, let's get the world out of the panic mode first. Okay, we all need to relax. We all need to realize that yes, we can fight it. We can save ourselves. We can protect ourselves. We can protect our near and dear ones. Only observing few protective measures. Now, first, let me get back to your pregnancy question. That yes, if a woman is pregnant, well, let me put this fact straight in front of you. First thing first, a pregnant woman in no way is more vulnerable to coronavirus than a general any other woman. Secondly, pregnancy in no way can lead to some complications due to the coronavirus. God forbid, if a pregnant woman is infected with coronavirus, it cannot lead to miscarriage. Well, there has been no evidence. When I say it cannot, I mean there has been no evidence to prove it, right? Apparently. Secondly, no premature deliveries. Pregnancy, a full-term pregnancy these days does not lead the obstetricians to believe that this is a call for C-sections. No, you can have the baby delivered normally or naturally as you would do under any regular circumstances. Third thing is that, this virus cannot be vertically transmitted from the mother to the baby.
All right. So
Let's make it very clear. No.
Yeah.
It cannot be vertically transmitted from the mother to the baby. Well, when we say this, what we mean is that it is not present inside the amniotic fluid. It is not present inside the umbilical cord. It is not present when the baby is passing through the birth canal. So the baby can, if a pregnant woman is, God forbid, diagnosed with coronavirus, she can still give birth to a perfectly healthy, normal, full-term baby.
Alhamdulillah. Thank you very much for this good news as well. But very quickly, towards the end of the program, there's one last question, and that is, what role do you think women can play in preventing this disease?
What role? Well, women have to play a very significant role in this. Again, I would repeat that almost 75% of the caregivers within their own domestic setups are women. And then 70% of the health caregivers, healthcare providers in the bigger hospital setups are again women. So we come to the situation again that what do we do with these women? Or what role do these women play? They have to play a very important role in this, because being a mother, you can sit down with your kids. Do not assume that the kids do not know what's going on. Kids are very smart these days. You know, we have a world full of social media. So they know, but try to sit down with them and tell them what coronavirus really is. Do not be fearful, do not be scared. It is something that is preventable: social distancing, washing your hands, observing hygiene, and then women are basically the caregivers for the older generation as well. So you have to be very, very vigilant about this whole situation. And then when it comes to the bigger hospital setups, of course, I mean, as I said earlier, 70% of the healthcare providers within the hospital setups are again women. So naturally, the brunt of the responsibility again lies on their shoulders. So when they are observing the personal hygiene, they have to be, we have to ensure that the women are in the fittest form of their own health. Of course, and healthy women are going to contribute a lot towards the healthy society.
That's great. Thank you very much, Dr. Nareen, for being with us. It was wonderful to be in conversation with you, ladies and gentlemen. For everybody who's out there, before I wrap up, there's only one thing which I'm going to mention, and that is that, ladies and gentlemen, everybody is vulnerable. And God forbid, anybody can pick up on this virus as well. So please make sure that you stay at home. So let me be very clear over here. Your friends cannot come to see you if you're in quarantine or if you're in isolations as well. You do not share or hug. You do not share your meals. You do not shake hands. You do not hug anybody. You make sure that you use your elbow, sneeze or cough over here within your elbow as well, so that your hands do not get dirty, and that there's no chance of anybody else catching up on whatever you threw out of your mouth as well. So, and I'm saying all of this is because of the fact that, ladies and gentlemen, that there's this normal understanding that the elderly are getting it. So, for everybody who's got their parents at home, because babies or kids are actually the super spreaders. That's what the UK has said as well, and that's why the schools are shut down. That's why the children are not going out. So just make sure that you're not going to visit your chachu's place, or probably your wife's not going to go visit her mom's place as well. That's how the disease is spreading. Everybody needs to stay in, and that's pretty much about it. Please make sure to look after yourselves, and if there's anybody who's in a problem, who's in a stress, we're going to share all the details from today's topic, and we're going to make sure that we write it on our Facebook page, which is with the name of World This Morning. On YouTube, ladies and gentlemen, we are PTV World. On Daily Motion, we are World This Morning. On Twitter, we are World This Morning without a G. So ladies and gentlemen, please make sure to look after yourselves and remember us all in your prayers. My cameraman, my MCR team, my boss, all the guests who have taken out time and made sure that they are going to come to our studios to talk about what can actually benefit the people of Pakistan and elsewhere in the globe, because we go out in 46 different countries as well. Please make sure to look after. Good morning. Bye.